Hi, I'm Monica Healy, founder of Ultrasound Dimensions, Medical and Maternity Ultrasound Centre in Dublin. Today I want to tell you a bit more about our pelvic ultrasound service. A pelvic ultrasound scan is a detailed gynecological examination of the female reproductive organs and one of the most effective ways used to examine the uterus, ovaries, and urinary bladder. A pelvic ultrasound is also used during pregnancy to monitor the health and development of the embryo or fetus. In males, a pelvic ultrasound usually focuses on the bladder and prostate gland. It is a valuable tool for evaluating the prostate gland as it will show enlargement of the prostate, also known as benign prostatic hypertrophy. In both male and females, a pelvic ultrasound examination can help to identify tumors and other disorders in the urinary bladder. We will also include an assessment of the kidneys as well. There are two methods of performing a female pelvic ultrasound. First is abdominally with a full bladder, and the second is transvaginally via the vagina. Transvaginally is used for more detail when needed for further clarification of findings. The same principles of high-frequency sound waves apply in each technique. It is completely safe. There is no danger of radiation. Here are some reasons why you might need a pelvic scan. You may require a pelvic assessment if you've had pelvic pain, lower abdominal pain, unexplained bleeding, heavy periods, missing periods, period pain, or mid-cycle and or postmenopausal bleeding, or difficulty conceiving. A gynecological scan assesses the health of your ovaries, uterus, and the lining of your womb, known as the endometrium. Pelvic scans are used to monitor ongoing gynecological problems such as polycystic ovarian dysfunction, ovarian cysts, uterine fibroids, or to diagnose endometrial polyps. It is also used to help diagnose ovarian or uterine cancers. With a full bladder, an ultrasound scan will give a clear view of your pelvic organs and will help determine a possible cause of the problem, or in the very least to try and eliminate the cause. This scan is performed externally using a transducer, such as this one, and gel, obtaining images by sweeping it across the tummy, or with an empty bladder done internally for more detail when indicated for further clarification. The transvaginal approach is painless and it resembles the insertion of a tampon. You will be asked to lie on your back, and a small transducer, such as this one, covered with a sterile sheath, is inserted into the vagina. The vaginal approach is most sensitive and appropriate method of examining the uterus and the ovaries. It can detect early diseases and conditions that cannot always be detected by the tummy approach. In addition to gynae problems, we can often diagnose bowel inflammation such as appendicitis, Crohn's disease, and diverticulitis. After and sometimes during the examination, you will have the opportunity to view the images and discuss the findings with the ultrasound practitioner. A formal consultant radiologist report will be issued to your healthcare provider, the one of your choice. It is important to discuss the results with your doctor. To prepare for a pelvic ultrasound for both male and female, a full bladder is required for a tummy ultrasound approach. So you are advised to drink at least 2 pints of water an hour prior to the appointment. There is no preparation necessary if you are having a dedicated transvaginal ultrasound. The length of your scan ranges from 10 to 30 minutes. I hope you found this helpful and informative in regards to our pelvic scan service. If you have any questions or to make an appointment, please email or call us today. We're always happy to help.